Hi, beautiful people. Good morning, good afternoon, and good evening from wherever you're watching me from. This morning, I want to quickly talk about threatened miscarriages. So, threatened miscarriages are situations that occur in pregnancies, early pregnancies, that may eventually lead to miscarriages. So, I'm going to give you a few signs, a few symptoms of what could cause a threatened miscarriage, what you would feel, to know that you are probably going through a threatened miscarriage and when you should quickly get to the hospital. So let's dive right into it. The major symptoms of threatened miscarriages in early pregnancy is usually lower abdominal pain or cramps. If you're having pain in your lower abdomen or in your lower back, or you're feeling this kind of grabbing pain that holds you and leaves you a form of contraction, that can be a sign of threatened miscarriage. Another sign of threatened miscarriage is, PV bleeding, where you see yourself spotting reddish or pinkish materials, from your body. This is also a sign of threatened miscarriage. And if you're having both at the same time, you're having abdominal cramps and you're also having this spotting, you actually need to get to the hospital because you might be having a threatened miscarriage, which may eventually lead to a complete miscarriage. The major causes of threatened miscarriages are: number one, stress. If you put yourself through a lot of stress in your early pregnancy, it may eventually lead to a threatened miscarriage. Although this does not apply to everyone because everybody's body type is different. Some people can be pregnant and be jumping Molue buses and they are fine. And then there are people that, are pregnant, but the moment they leave the pin, they start to spot. So, but generally, it is agreed that stress can be a factor that can cause a woman to start having threatened miscarriages. Number two is trauma. If you have trauma to the abdomen, trauma or injury to the abdomen or to the lower back, it can induce a threatened miscarriage. Another one is chromosomal problems. If there is an issue with the baby's chromosome, if there's an issue with the genetic makeup of the baby that you're carrying, or there is an issue with the rhesus factor compatibility between both partners, it is very much possible that it can induce, miscarriage at the early stage. So it's not all miscarriages that are caused by external factors. There are miscarriages that are caused as a result of both partners not being compatible. Other causes of threatened miscarriage include smoking, alcohol consumption, obesity, and some form of uterine infections. How long can a threatened miscarriage last? It can last between a few days to several weeks. There is really no stipulated time as to when a threatened miscarriage will come and go. We diagnose it by doing a pelvic ultrasound and by doing a blood workup, as well as checking for your rhesus factor compatibility. All right, so this is how you can get that diagnosis. And then what can you do after you've been diagnosed of threatened miscarriage? What can you do? Basically, what we do is called watchful waiting. We really don't do much, but then we advise for a bed rest and we wait. We watch and wait at intervals. Sometimes we wait for 3 days to 1 week and you're asked to revisit the hospital. We can also do a pelvic exam to make sure that your cervix is closed. And if you need a cervical sacrilege, we can go ahead and recommend a cervical sacrilege. But majorly what we do is watchful waiting. Another thing we do is hormonal supplementation, where we recommend progesterone injections because we'll go ahead to check your hormone levels, and low progesterone level can be a sign of threatened miscarriage. So if that is the case, you can go ahead and get your progesterone supplement. You can prevent threatened miscarriages by avoiding alcohol, avoid smoking, take enough bed rest, eat healthy, take your routine drugs, take a little bit of exercise on a daily as you can. And if you're going through any kind of infections, make sure to get treated before or even during the pregnancy. Make sure to consult with a gynecologist and make sure to get yourself treated. Thank you guys so much for watching this video to the end, and I'm going to see you on my next one. Bye guys.